Hi, this is Dr. Kim Tran with Minnesota Family Chiropractic, and I'm going to talk to you today about low back pain. It is one of the most common complaints that we see in right now, especially with more people working from home in really awkward positions. They're sitting on a couch, they're sitting on their countertop, maybe sitting at their kitchen table. I've actually seen an increase in low back pain. And one of the main reasons that we take x-rays is so we can actually see where the problem is in your body. So what most people don't realize is that for you to have a properly working body, we should see these 345-degree curves and your spine should be straight up and down. So when we look at this, it doesn't take much pressure on this nerve to actually cause pain. We actually see that a joint can move out of place by just a couple millimeters to shut down function and cause pain into the body. What we also see on x-rays is you'll see here, this is from the front part of the spine. So this left side, that's the right side over here. What we take a look at is that spine, as we talked about, should be straight up and down. And you can see this patient came in with a lot of low back pain, actually had a curve going off to the side. What we also found with this patient is, not surprisingly, they also had a lot of digestive issues. That's very common with a lot of people because if you take a look over here, you can actually see that these same nerves right here in the low back also go out to your colon, your digestive tract. And so what we can see is things like constipation, diarrhea, IBS, and other chronic digestive issues. Many times our patients, once they start getting adjusted, they actually find that they can actually digest food better. They have regular bowel movements. Really, you should be having a bowel movement about 2 to 3 times a day, at least once a day. If you're not going once a day, there's a problem, because what happens is if this nerve is pinched down to these organs, it actually causes these organs not to function as well. So we see a slow in mobility because your digestive organs work like a muscle. They have to be able to push that food through. They need to be able to digest the food down for you to absorb the nutrients. So I'll see very common with my patients is they either have more constipation issues, they have things like anemia, vitamin D deficiency. In actuality, the last patients that I've done over 10 labs on, they all came up vitamin D deficient, especially here in Minnesota where it's winter, but they were also not digesting their food well. Let's go ahead, let's take a look from the side. And this is where we talked about we should have a really nice 45-degree curve. You can see same thing happened with this other patient is their spine was very straight. What this does is a spine that is misaligned and starts to subluxate is what we call it, actually causes pinching of the nerves, the spine all the way down. This can also cause pain not only in the low back, but also down into the legs, the knees, and feet. Now, if this is something that you're experiencing, one of the best things that we do here in our office is one, go through and do a full exam, a consultation, but we also want to make sure that we're taking x-rays to see how those nerves are functioning out to the rest of your body. So if this is something else that you've been struggling with, please feel free to give us a call here at 612-545-5672. You can also share this with anyone else that you feel like would benefit from this information as well. If you have any other questions, comments, feel free to leave a comment below. Thank you for sharing today, and we look forward to seeing you soon.